Hey, Dr. Derek Nielsen. One of the most common questions that I get from people is, what should I do about pain? So these are people that are current clients of mine, so they're obviously getting help for it, but they're wondering, okay, if I go, say I go on a run or I go on a walk and I start to have some pain, does that mean I should stop or what should I do? And today I want to outline really a really simple way of thinking about it when you do have pain with any sort of activity. But first I want you to realize, let's talk a little bit more about pain itself. I want you to realize that just because you have pain doesn't always mean that there's damage. It doesn't always mean that there's a torn muscle, torn rotator cuff, or torn meniscus, or your arthritis is acting up. It doesn't always mean that. It doesn't always mean there's damage. If that's a new concept to you, the first thing you really should do is read my book. If you're a current patient or if you're somewhere in the area, in the Durham area, I'd love to give you a hard copy. You can contact me for that. Or you can download a free copy of your own by going to www.thepainreliefbook.com, and you can download a copy there, where I talk about the common misconceptions about pain. So you really should first educate yourself on what pain is and what it isn't, because a lot of times it's not damage. It's really just a check engine light of your body telling you, hey, something's going on. We need to change something. And that's really what I want to talk about today is when you're feeling pain with activity, I want you to think about it as really this simple strategy is, can you modify the activity that you're doing? So for example, if I'm out and I'm going on a run, can I modify my heel and toe strike when I hit the ground? Can I modify my pace? Can I modify my breathing? Anything. Is there anything that I can do to modify the activity that I'm doing? Does it change the pain? Recheck in with yourself. Does it change the pain? Does it increase it? Does it decrease it? If it increases it, obviously that's not the right strategy. Try and do a different modify. If it decreases it, you're good. Keep going, keep moving. If it doesn't do anything, or obviously if it does get worse, try a different modification. But if it does get worse, then that's the time to stop and check in with yourself. Take a little bit of a break, take a breather, and then try and go for that same activity again in a couple minutes and see what your body does. And you can always try and modify again. The thing I want to teach you and educate you is that pain is there for a reason. You need to check in with yourself. Check in with what you're doing, what activity you're doing, where it's felt. Can you modify? Can you change anything in order to decrease the pain? The thing you don't want to do is just try and shut it down, or worse, mask it with some sort of painkillers, because it's trying to tell you something. If your car engine light is on, the last thing you're going to do is try and just turn that light off and say, okay, we're going to keep going. And I'm just going to turn that light off. I'm going to unplug it and keep driving my car. That's similar to what painkillers are. We take the medication, we just turn the check engine light off. We know it's there, it's still there, but we try and mask it and just turn it off, turn the light bulb itself off, and keep pushing through. Not the right strategy to look at this. You want to check in with yourself again, see if you can modify. If you can modify and it makes it better, keep going. If you modify it and it doesn't help, take a break. A lot of times what I find with patients is at first movement hurts. So let's say they go on let's use walking for example. Let's say walking hurts at first, and they continue walking and pushing through it a little bit, and the pain decreases. That's going to happen with a lot of people with a lot of activities, which means you're doing the right thing. Just keep going. But I want to help you and tell you that you really should listen to your body and listen to what it's telling you, because it's trying to say that there's something going on that you need help with. And again, it doesn't always mean there's damage. It could be as simple as a movement problem. The things that I find here most often in the clinic, with patients who come to me is there's a certain area in the body that's not working like it should, which is causing another area to have to work overtime. The area that works the hardest is the area that hurts the most. So, most people in healthcare will treat the area of pain. Yes, that can help with the pain, but it doesn't get to a long-term solution if we don't treat the entire body to help you really move and function fully everywhere in the body, so there's nowhere that is compensating for one another. The area that compensates the hardest is the area that hurts, and it's not even the problem other than the pain itself. All right, I hope that was helpful. Listen, again, if you haven't read my book, go to www.thepainreliefbook.com. Download that. If you're in Durham, don't hesitate to reach out to me. I would love to send you a hard copy straight to your doorstep. Talk to you soon.